Hey everyone! So the time has come for you to elect your specialization in the hygiene program, which is so exciting. I could stand here and tell you all there is to know about the EFDA curriculum as a whole, but what I think would be more valuable to you in your decision making as far as what's going to be best for you in your careers as future dental hygienist is to kind of hear it from the experts. So please just give me a couple of minutes of your time for you to listen in to what some of my friends have to say about either their lives as hygiene EFDAs or their perspective of hygiene EFDAs. So first, we're going to hear from a dentist in private practice here in Central Ohio. And hopefully this video will provide you with some perspective on what future employers might think about hygiene EFDAs and how hygiene EFDAs are really valuable in the practice. And then following this, you'll see a series of short interviews conducted by me with some hygiene EFDAs who are either actively practicing as EFDAs in their private practice or passively use their EFDA education in their hygiene careers. And some of them went through the EFDA specialization as part of their hygiene program, and some of them went back to get their EFDA specialization after being in the hygiene career for some certain period of time. But spoiler alert, they are all very happy with their decision to go through the EFDA curriculum. So please just give me a couple minutes of your time and listen in.
Hi, my name is Morgan Teamstra. I graduated from the Ohio State College of Dentistry in 2016 and currently practice in Dublin, Ohio. We see patients of all different ages and do primarily restorative dentistry treatment. We are a practice that highly utilizes EFDAs in our office. All of our assistants do have their EFDA certification, and all of them but one are also hygienists as well. The great thing about having an EFDA or EFDAs in our office is that we do have a lot of hygiene checks as the dentist. So while we're doing the hygiene checks, it's great because our EFDAs can be continuing the appointments or starting the appointments for us so that we can optimize the amount of care that we can give during a day, allowing us to see more than one patient at the same time. Some ways that our office utilizes EFDAs are restoring teeth after decay removal with composite fillings. We also got a 3D scanner about 2 years ago, so it's great because the EFDAs are all very proficient in scanning for implants, crowns, guards, retainers. So those are all great things that we utilize them for. Another thing that we utilize them for is for a crown appointment. They can do pretty much everything but drilling on the tooth. So a lot of them are, like I said, hygienists, so they can get the appointment started by numbing the patient. Once the decay removal is done and the crown prep is done, they're able to build up the tooth to do the crown buildup. Our office would not be what it is without all of the EFDAs that we utilize every day.
All right, Miss Colleen, you graduated from OSU's dental hygiene program when?
In 2002.
Woo! That's awesome. Why did you select to do the EFDA specialization?
Of all of the specializations that you could go into, I really wanted to do EFDA because I really wanted to learn more about our role versus the doctor's role and to be able to answer questions for the patients. They have a lot of questions about restorations, and really we have a lot more conversation during our appointments than the doctors have time to allow sometimes with their questions.
Yeah, the time in your hygiene appointment?
Yes.
Yeah.
Yes, for sure.
And then do you practice both hygiene and EFDA?
So in 2002, when I graduated, I'll be honest in saying that EFDAs did not earn as much as they do now. So when doctors found out during interviews that I had my EFDA specialization, they were very interested. I thought it put me a little over the edge versus some of the other girls that maybe didn't have their EFDA specialization. And so I think that was helpful. At my very first job, I actually did a lot of occlusals at that office. A lot of the times, if somebody had a simple occlusal and they had to add that to the schedule, I totally did that. And then as I worked more, I did a lot more hygiene. I still currently do a lot of hygiene, but I'm starting to slowly get back into more fillings and that sort of thing. I think overall it provides variety in your day.
Yeah. At your current practice, does when you do some EFTA, do you have to like clock out and clock back in as an EFTA, or is it the same hygiene rate? How does that work?
I do not. So at my current job, what I earn as a hygienist is what I also earn during EFTA. So I do not clock in and out. When I clock in the morning, it's when I clock in. When I clock out at the end of the day, it's when I clock out. I think that's something to discuss with the dentist if you are going to practice EFTA, if they're going to slide some EFTA things into your column. I definitely think it's a lot more helpful and versatile so that when you're seeing emergency patients, if that emergency does turn into something that you can help with, it's something that a patient doesn't have to come back for. And I think they're really appreciative of that.
Yeah, perfect. Thank you so much. All right, Miss McKenzie, you graduated from Ohio State Dental Hygiene Program in what year?
2016.
Great. And why did you select to use the EFTA specialization in hygiene?
I chose to do both hygiene and EFTA to have the flexibility, especially just with the schedule changes. It's nice to be able to like jump back and forth if the assistants or doctors need any help. So just to have a variation of, tasks and things to be able to do different options.
Yeah. Do you practice both skills?
I do more hygiene, but I do help with EFTA on days where the doctors need additional help.
Perfect. Even though you don't utilize your EFTA too often, do you see benefits to your hygiene practice since you have that training?
I do. I think that just going through the EFTA schooling and learning all of the different types of materials and instruments, that has helped me with oral hygiene instruction with patients, just knowing the types of materials and being able to help them, tell them certain areas that they're missing. And I do feel like it's helped.
Okay, thank you so much.
Thank you.
All right, Jess, you graduated from the Ohio State Dental Hygiene Program in what year?
2015.
Woo! All right, why did you select to do the EFTA specialization?
Originally, looking into it, I was looking at what I could get out of it, and I was able to get an extra certification. That was something that drove me to do it. And then also, I didn't know much about fillings when it came to hygiene, so that got me. I was like, well, at least I'll learn a little something about fillings that way.
Yeah, great.
Yeah.
Did your cross training have any outcome on your job search post graduation?
So originally, looking for a job, I just applied to a couple, and I didn't know what I was going to do. But then I did get hired in as a hygiene EFTA, knowing that I was going to do both at the time.
Yeah.
So yes.
Yeah. So you do practice both skills currently?
Correct.
Yeah.
Yes.
What does your typical day look like?
I do a lot more of the restorative end of it. But with hygiene, I do anesthetize majority of our patients. And then dentists will come in, prep the teeth, fill them, then they'll come back in and double check it. There's occasional times where I'll cover hygiene if someone in the office is out, or they'll do a mixture of a couple hygiene patients and restorative. But mostly it's restorative and then helping out with my hygiene that way.
Yeah. And what benefits do you see being cross-trained and utilizing both of your skills?
I'd say I've learned a lot more dental-wise. There's a lot that comes with restorative and the EFTA part that you don't see through hygiene, and then also with hygiene, doing exams and everything, you can see more with the restorative end of that as well.
Yeah, right. And then how does it work as far as your pay goes?
It's the same either way. If I'm doing hygiene or if I'm doing EFTA, if I'm doing a mix of both, my rate is still a flat set fee.
All right. Anything else you'd want to tell any of the students considering EFTA?
I love it. I like EFTA a lot because I do enjoy the change in my day. It's not repetitive through hygiene all day long, so I do enjoy that part of it a lot.
Yeah. Did you like it this much when you were in school? That's a good question.
No, I did not,
Yeah,
actually.
right, same.
So that is a great question. Yeah, when in school, I feel like it was, you had to follow all these things and be checked on all this stuff, and it's a lot different private practice and outside, for sure.
Yeah, good.
Yes.
All right. Thank you so much.
Thanks.
All right, Della, can you tell me where you went to hygiene school?
I went to Youngstown State University,
And when did you graduate?
2003.
Crazy.
Yes.
Did they have EFTA as an option for you to do?
They did not. It was just hygiene
Okay.
school. So
And how long did you practice hygiene before you decided to go back?
about 10 years I practiced hygiene.
And what made you decide to go back and pursue EFTA?
After 10 years, it gets a little bit repetitive. So I needed something different in the day.
Yeah.
Some kind of change. I was getting a little bored.
Yeah, so you went through a continuing education program,
Yeah.
and that was at Ohio State?
Yes, at Ohio State.
Yeah. And did you experience any challenges with going back while you were already practicing?
Well, because I was already 10 years after school and into my life, I was at the point where I was having babies. So I just had a baby when I was going back. So I went back after I had a 4-month-old.
Oh my
So
gosh.
not only did I have to take a day off work, but I also had an infant at home, and it made it a little bit more complicated. It would have been a little easier if I did it at the same time, and I didn't have to take that time out of my life.
Right. Right.
But yeah.
But in any case, what do you like? Are you happy with your experience?
Best decision I ever made.
Yeah.
Because it's something different every day. You get to do something new, and I needed that change. Like after 10 years of cleaning teeth, you need to
Just do something
do
different.
something different every once in a while. And you can still go back and forth and clean teeth, so it makes you more useful around the office too. Like you can kind of fit in wherever you're needed.
Yeah. Is that kind of what you do now?
It is. Typically I do EFDA stuff, but every once in a while, like when we're running behind or we need something, then I can always jump in and fill in for hygiene.
Yeah. Or like covering vacations even too.
Yes.
I can see that
Yeah.
being a benefit. All right. So best decision. I like to hear that.
Yes, best decision.
That's
I don't know
awesome.
if I'd still be doing dental if I didn't
Yeah. Just have
the
something else.
change. Yeah, something
All right.
different to do.
Perfect. Well, thank you so much.
Absolutely.
All right, Miss Hillary. So you graduated Ohio State Dental Hygiene Program in what year?
2013.
Yeah. So close to me. Why did you elect to do the EFDA Specialization in hygiene?
I did EFTA because I felt like while I was in school, I should have learned as much as I can while I'm there. And if I were to go back and do EFTA after hygiene, it was going to be more expensive. So I was kind of just getting it done while I was there.
Yeah. Do you practice both skills?
I do not right now.
Okay. Have you ever in practice?
I have never.
Okay.
But I'm new to the office that I'm in right now, and I think they want me to start using it.
How do you feel about that?
I'm kind of excited.
Yeah.
I'm not sure how it's gonna. I feel like they're gonna be really nice and be slow, like put in like just an occlusal at first in my schedule. So, but I'm kind of excited to switch it up a little bit.
Right. I mean, you're 10 years out from hygiene, so you know that could be daunting, but also it could be like really exciting.
Yeah.
Just a different change
Something
of pace.
different,
Yeah.
yeah.
I was only 1 year out when I did my first, but that was like scary enough.
Yeah.
But it was the same, just slowly working in. Even though you don't practice EFTA, do you see benefit in having that training in your hygiene practice?
Yes, I feel like it's beneficial. One, to help get a job. I feel like an employer would hire you more if you have that skill, but also helping to determine if like a filling needs replaced and like knowing what the margin should look like. I feel like it's very helpful.
Yeah.
Yeah.
All right, perfect. Thank you so much.
Yes.
All right, so hopefully you are still with me, and this video provided you with a little bit of perspective on why going through the EFTA program might be valuable to your future careers as dental hygienists, either providing some variability in your dental career or at a minimum, just a wealth of knowledge that you can bring to your hygiene careers. If you have any further questions, please reach out to me, any of our current hygiene EFTAs, or even any dental students who had went through the hygiene EFTA program in the past. I know every year we have some of them too. So any of us have the knowledge and the history of what the program is like, and we can provide you with some information on that. So please reach out to us, and don't hesitate to ask any and all of your questions. Thank you so much for your time.